Miss Joan. I'm Azrina, the pharmacist. I'll be reviewing your case for today. Can I just double check your full name and your ID number to make sure this prescription is for you?
I'm Merlin Joan. My ID number is 13579.
Okay, thank you very much. Right, so it's the first time I'm reviewing your case. I just need to ask you a few questions to make sure that the medications are safe for you. But if you're uncomfortable answering any of the questions, just let me know, okay? So the first question is, do you have any drug allergies that you're aware? Okay, thank you. Are you on any long-term medication, supplements, or herbal remedies?
No, I don't take any long-term medication, but occasionally I take paracetamol when I have a headache.
Okay. Do you get these headaches often or just sometimes? And do you have like any long-term medical conditions you're aware of?
I don't take them often. I usually get a headache when I'm stressed.
Okay.
And recently I found out that I'm 3 weeks pregnant and I'm diagnosed with HIV.
Okay, thanks for letting me know. Right, I prepared the medications for you based on the prescription that I've received. But I noted that you haven't used these medications before, so I need a little bit of time just to explain how to use them fully with you. Can you spare me about 5 to 10 minutes of your time? Right. So before I go through the medications, do you have any questions or concerns that you would like to let me know first?
Actually, I'm wondering if I'll be able to continue working. And I'm worried about my relationship with my partner.
Okay.
I believe he's also HIV positive.
Okay.
Also, will my baby be infected with the virus? And if the medicine that I'm taking will affect my baby?
Okay. And I see you've put a lot of thought into this. Right, I'll go through your concerns later as I go through the medications with you. Okay? So the doctor has prescribed you 3 medications and they are all for the HIV virus. They work by making your immune system stronger so that you can reduce the amount of virus in your body. And they will also help you prevent the transmission of HIV from you to your baby. All of them work in slightly different ways, but they are all necessary just to keep the virus load down. Okay. All these medications are to be taken orally and your doctor has prescribed you about a month's supply, so this is what I'm giving you first. So the first medication, this one, is actually a combination of 2 different active ingredients. It contains 300 milligrams of tenofovir and 300 milligrams of emtricitabine. So this one is called FDC. We take this one once a day with or without meals, doesn't matter, right? So the second medication is actually called ATV. It contains 300 milligrams of atazanavir, and this one has to be taken 1 capsule once a day with meals. So the last medication is also a capsule. This one contains 100 milligrams of ritonavir, and it's also to be taken once a day with meals. So as all of your medications need to be taken once a day, you can take them all at the same time. It's okay to do that, right? Because these 2 have to be taken with meals, I would suggest that you take all of them with your biggest meal of the day. But because you mentioned that you're actually 3 weeks pregnant, you might experience some morning sickness in the near future. If you do experience any of this, you have to make sure that you take them away from your episodes of like vomiting and nausea, because if you do vomit them back out, then you are not getting enough of the medication in your body. So with all of these medications, if you do miss a dose, it's very important that you take it the moment you remember it. Although if it's too close to the next dose, then make sure that you take it only once, don't double dose, right? Just skip the previous dose that you missed. And for storage wise, you need to keep this in a cool, dry place. So keep them all in like a cupboard or in a drawer area, but try not to keep it in your kitchen or your bathroom because they can be very humid and hot places. With all of these medications, you might not feel anything when you take them, but it's very important that you keep taking them because it's not an observable effect. They help to reduce the amount of virus in your body. What you need to do is to see your doctor again just to get a blood test to check if the viral load is really going down. Okay? So keep taking it even if you feel fine. The only reason why you might want to stop taking them is if you have any side effects. As with all medications, there are side effects, but you might not experience any of them at all. Okay? So some common ones include like nausea and mild diarrhea, but if they are still tolerable, you can continue taking the medication. It's only when, say, you get it like all the time, all day, then you probably best to see the doctor and just get it checked out. Another thing is that changes in your immune system can happen when you take these medications because they work on your immunity. So if you have any new signs of an infection like fever, difficulty breathing, sore throat, then I would recommend you also check with your doctor just to make sure nothing's going wrong. In addition, some side effects where you would have to see your doctor immediately include signs of an allergy like swelling of the eyes, swelling of the lips, any rashes or difficulty breathing. And another thing that you would have to look out for is also yellowing of the eyes and skin, as well as any abdominal pain or nausea and vomiting accompanied with this abdominal pain, which could be signs of something more serious. Another common misconception about these medications is that they actually help to completely get rid of the virus. But what these medications do is that they keep the amount of virus as low as possible. So that means they don't stop the spread of disease. You mentioned previously that you're not sure whether your partner is actually HIV positive, right? Try to get him to go for a screening, but until you find out, practice abstinence with him and avoid having any sexual intercourse without the use of like a polyurethane condom. Also try to avoid using any toothbrushes or razors with anyone else, which are all things that can get into contact with blood or open wounds. Other than that, you mentioned that you sometimes take paracetamol for your headaches. There's no concern with taking that with any of these medications, so don't worry. In fact, paracetamol is also safe for pregnancy, so you can continue taking it at your recommended dose whenever you have your headaches. So all that being said, it's also important that you see your doctor routinely. So I would recommend that you book an appointment with your doctor within the next 2 to 4 weeks to get the blood test run just to check whether the amount of virus in your body is going down and whether this medication is really effective for you. Lastly, it's really important to eat a healthy, well-balanced diet and make sure that you sleep enough. So try to get at least 8 hours of sleep a day and at least 20 minutes of activity, kind of like exercising or doing healthy things a day. All of these things will add up because they help to keep your immunity strong and fight the virus along with your medication. Right. So do you have any questions for me right now?
I heard that the medication will cause birth defects in the baby. Is that true?
Okay, well with any medications there are risks, but generally the findings so far for all of these medications have been that there is no increased risk of birth defects with these 3 medications. Okay, so thanks for bringing that up. I know you're also concerned about whether the virus will spread to your child. While it's not 100% effective, at least these medications are kind of like a safeguard to make sure that the virus is low so that it doesn't pass on to your baby. Lastly, these medications are pretty expensive, but they are necessary. So do you think that you will have any issues kind of continuing them for the long term? Because you will have to take them for life.
Honestly, yes, because we're starting our family and everything now,
Mhm.
and I don't even know whether I can continue working, keeping my job in a convenience store.
What I can do for you is I can check for subsidies or cheaper alternative to the medications that your doctor has prescribed. But for now, I will still recommend that you take the medications first. Book an appointment with your doctor in about 2 weeks' time. And before that, you can come back. I'll give you a memo to pass on to the doctor with cheaper alternatives or any subsidies that you can possibly use to get better, more cost-effective care. Right? About stopping work though, you can definitely continue to work. You know, perhaps in the past HIV was kind of like an end and the treatment options weren't very good. But now you're finding out early and there are very good treatment options. So the chance of you having a long, healthy, normal life with your child is really quite high. Okay, so don't worry too much. Do you have any other questions for me? Okay. This is my name card. If you do have any other questions, you can just contact me at this number. Definitely I'll be happy to assist you. My name is Azrina, so just let the person on the phone know. Okay?
Thank you so much.
No worries. Hi, my name is Azrina and I'm a final year student at the National University of Singapore. I'm representing the Asia Pacific region today as a finalist in the IPSF Online PCE Competition 2018.